How do the intervertebral discs in your spine work? And how does each disc with its pressurized fluid core wrapped in circular layers of collagen give your spine flexibility and the ability to bear compressive loads? Hi, I'm Dr. Maria Conley, and today I'd like to talk more about the intervertebral disc and how the spine can be understood by breaking it down to its smallest biomechanical component, the functional spinal unit. In the last lecture, I talked about how the spine is actually a complex structure of many different tissues, starting with a stack of floating bones that are held together as a flexible column by ligaments and paraspinal muscles. We learned that muscles actually impose the most compressive force on the spine as they work to counteract the effects of gravity. We learned how each vertebra is a complex bone consisting of a front unit, which would consist of the vertebral body, and then a back unit, which would be the neural arch here, which houses the spinal cord, and also the facet joints, which connect each vertebra to one another. The vertebral bodies and intervertebral discs provide resistance to compression, while the facet joints in the back of the spine resist the shear forces that cause movement of adjacent vertebra forward or backward in relation to the spinal column. Facet joints also provide resistance to torsion. The intervertebral discs allow even distribution of pressure between each vertebra. We can better understand how the spine moves by breaking it down to its smallest biomechanical component, or its functional spinal unit. This unit is made up of three joints: an intervertebral disc, which forms a fibrocartilaginous joint between the two vertebrae in the front, and the two synovial facet joints in the back, which connect two adjacent vertebrae from top to bottom. This three-joint complex can move in three different planes: bending forward and backward, bending to the left and right, and rotating from to the left and to the right. The first component of the functional spinal unit that breaks down with age is typically the intervertebral disc and its adjacent vertebral end plates. The problem with the intervertebral disc is that it receives very little blood supply and thus oxygen, and cannot repair itself like muscle tissue can. So what does an intervertebral disc look like? I like to think of the disc as a sliced onion with the center cut out and replaced with thick slime, like that toy slime you can buy at Walmart or something. This jelly-like center is composed mostly of water and is called the nucleus pulposus. When a compressive load is applied to the spine from above, the pressurized liquid in the nucleus can absorb this force and transmit it outwards to the circular layers of the annulus fibrosus. And those layers are all made of that tough collagen material. The layers of the annulus are the layers of the onion in our analogy. The annulus fibrosus consists of about 10 to 20 circular or concentric layers of collagen. The orientation of the collagen fibers alternates in each layer, which allows the annulus to handle loads from several different directions. The anterior portion of the intervertebral disc is compressed slightly when you bend forward. It also compresses in specific areas to allow extension and lateral flexion of the spine. When you rotate your spine, the tension generated during twisting is resisted by those tough fibers of the annulus. Each intervertebral disc is about 5 to 10 millimeters in height. Taken together, the discs actually contribute about 25% to the total length of the spine. When arising from sleep, your intervertebral discs are at maximum height because lying in bed for hours allows the disc to reabsorb all the water that was squeezed out during the previous day while your spine was upright and getting compressed. This explains why you lose about 2 centimeters in height from the time that you wake up to the end of the day. The spine is also the most resistant to forward bending in the morning when the discs are full of water and at their maximum heights. Next, we'll talk about how the degenerative cascade theory of the spine describes how the intervertebral disc first begins to degenerate as young as maybe 20 years old, causing it to collapse and lose pressure. Now, this loss of disc height causes instability in the spine and causes a chain reaction. Loading is then transferred from the vertebral body in the front units, to the facet joints in the back. Increased pressure on the facet joints leads to osteoarthritis and sometimes pinching of the nerve roots as they exit the spine. Any step in this process, this degenerative cascade, can cause back pain, which may sometimes radiate down the legs if the nerves are involved in getting pinched. Thank you for listening. I hope that this has been helpful for you.